hormones that work on the kidneys. So the first one is aldosterone. It is secreted by the adrenal cortex, and it stimulates the reabsorption of sodium in water and the excretion of potassium. It is called the salt-retaining hormone, and it expands or increases blood volume. So renin releases aldosterone. This is an enzyme that activates the renin-angiotensin-aldosterone system. The renin is secreted by cells called the juxtaglomerular apparatus, and the renin activates angiotensin for angiotensin 1. So this is an enzyme that's called the converting enzyme. It changes the angiotensin 1 to angiotensin 2, which stimulates the adrenal cortex to release aldosterone. So angiotensin 2 is a potent vasopressor. It is a BP elevating agent, so it's going to raise your blood pressure. And the activation of renin-angiotensin system helps regulate blood volume and blood pressure. So a class of angiotensin converting enzymes, which means your ACE inhibitors, are going to lower blood pressure by preventing the production of angiotensin 2 and aldosterone, which increase blood pressure. And we know those ACE inhibitors end in the suffix of pril, such as lisinopril. So then you have your antidiuretic hormone, ADH. And ADH allows the kidneys to concentrate urine. It's secreted by the posterior pituitary gland, and it works on the collecting duct of the nephron unit by determining its permeability to water. So ADH decreases the urinary excretion of water and causes excretion of a concentrated urine. So in the absence of ADH, you're going to have a large volume of dilute urine. The ADH expands blood pressure and blood volume. And so if they're lacking it, they're going to have a decreased blood volume. The hyposecretion of ADH causes diabetes insipidus, and that is the excretion of a large volume of pale dilute urine. So next we have our natriuretic peptides, and you have your ANP and your BNP, which cause excretion of sodium, a process called natriuresis, so that's your sodium. So ANP is secreted by the walls of the atria of the heart in response to an elevation in the volume of blood. The BNP is secreted by the walls of the ventricles in response to an elevated ventricular volume. So the effects of the natriuretic peptides are opposite of ADH and aldosterone. Because the ventricular blood volume increases in the failing heart, BNP is used diagnostically in the assessment of heart failure. Then you have your parathyroid hormone, PTH, and calcitonin. So PTH is secreted by the parathyroid hormone. It regulates two electrolytes, which are calcium and phosphate. So PTH stimulates the renal tubules to reabsorb calcium and to excrete phosphate. The excretion of phosphate is called the phosphorytic effect. The primary stimulus for the release of PTH is a low plasma level of calcium, which causes calcitonin to respond, which then is secreted by the thyroid gland. So calcitonin is released in response to an elevated plasma calcium and causes the kidneys to excrete calcium phosphate. So those are your four hormones that work on the kidneys: aldosterone, your ADH, your natriuretic peptides, and the parathyroid and calcitonin.